Hi everyone and welcome to Making It on Monday, and this week we've got a special guest. We've got Jaclyn McPherson. Jaclyn is a CBD director at the Acupuncture Pregnancy Clinic, and she has a particular interest in laser acupuncture. So Jaclyn, thanks for coming today.
Thanks for having me. Thank you.
Today she's going to talk all about laser acupuncture. So to begin with, I guess, Jaclyn, could you tell us a little bit about what is laser acupuncture?
Yeah, so when most people think of acupuncture, you're thinking of a little metal needle to stimulate the acupuncture point, and thinking perhaps if you don't have a needle, it's not really acupuncture, but there are different ways that you can stimulate the point. You know, we have acupressure, you could press it. We have the most commonly known one where you using the fine filiform needles to put in, but you can also use a cold laser, which is what we use to stimulate the acupuncture point. So with that, what we do is we have a cold low level laser, and that laser emits light energy, and that is just a different way of stimulating the acupuncture point. So you can use a laser to stimulate your acupuncture. You can use it needle free, but something that we also use at our acupuncture pregnancy clinics is we use a laser for something called photobiomodulation, which is basically using light therapy to affect the cells in our bodies and increase ATP output, basically making them increasing mitochondrial function. And that's something you can do with all cells in the body, but within our clinic we have a special focus to that towards fertility, obviously.
Yeah, great.
Yes.
So ATP is like the energy in the body, and the mitochondria is like the sort of what energizes all the cells and makes them healthy.
Powerhouse.
Is that right?
Us allied health practitioners, we're all about increasing mitochondrial function. No matter who you see, a nutritionist, they want to change your diet to increase that ATP mitochondrial function. See a naturopath wanting to do that. And same thing with acupuncture. We know as part of the biomechanism of that is to increase vasodilation to, again, increase that ATP mitochondrial function. The laser, cold laser, and the low-level laser therapy is just another way of doing that. And we just want to take advantage of all the, the classic and the modern resources we have available to our patients.
Yeah. And I think what's great about laser acupuncture is that patients often love is that if they're a bit needle phobic, that they don't feel anything. So can you talk us through about like what it would look like to get laser acupuncture or laser, like low-level laser, and what's happening? Why that's happening? Why you're getting it, so even though you feel nothing.
So when you think of a laser, you may be thinking of like surgical laser or hair removal laser, when you get that elastic band little pinch feeling. This is a different thing. So lasers, you're using light energy, but we're using a cold low-level laser, and what that means is we're using a specific wavelength on the electromagnetic spectrum that is basically it's just light. But you can use light to affect your cells in your body to increase that ATP mitochondrial function, because you're stimulating something called a photochemical reaction. So those things happen in our body all the time. Just think about melanin in our skin. When we're exposed to sunlight, you get a tan. It's a photochemical reaction. So different cells in our body respond to light. And when you use a cold laser with this, it's using just a red light or slightly beyond that, the infrared spectrum, you're just inducing a photochemical reaction to increase your ATP mitochondrial output in different cells in the body. So yes, what a patient can expect is actually to feel nothing at all, because same as if you just put a flashlight on your hand, but using a laser is a focused light beam. It's just going to, again, stimulate that healing benefit. But what you can expect is basically we swab our laser. The only thing you're aware of is the contact of the probe touching the skin. Once it's on, there's no sensation of heat, there's no sensation of buzzing or anything like that. It is purely just you feeling the contact of the probe on the skin. But that light, focused light, is coming down to the tissues that we're wanting to affect, or the acupuncture points that we're wanting to stimulate.
Great.
So there's nothing, there's no pain whatsoever, but it is still very effective, again, because there's many ways that you can stimulate tissues and acupuncture points.
Light therapy.
Yes.
I really enjoy using laser, and I know that there's been research around it in terms of like wound healing. Like I've used it quite a lot for like scars and wound healing, as well as like pain and inflammation, people use it as well. So it's
Exactly.
used kind of quite broadly for this sort of systemic effect. It seems to be reduce inflammation to a point, as well as stimulate ATP.
Exactly.
Do you want to tell us a little bit about maybe like the research and the mechanisms around it?
Yeah, so just touching back on, it stimulates that photochemical reaction. Not to get too into it, but basically you're encouraging cellular respiration. So in humans, they're all eukaryotic cells, and they all perform cellular respiration, and we know that because it takes all our cells, they take glucose and they need oxygen, and they put that through the Krebs cycle, respiratory train, and from that the output is ATP, mitochondrial function, which is what allows each individual cell to do what it needs to do. So that's what we're using the laser for. Sorry, I've lost my train of thought there.
That's all right. Yeah. So I mean that's great in terms of like the mechanism. Yeah. And then there's this research out there that suggests that it's like really good for mitochondria, and it's often used in wound healing, things like I was just wondering about.
So the way it works with that wound healing is it's increasing, so we know that we have increased ATP and mitochondria. It also increases vasodilation through a few mechanisms there, but basically you can expect where you use the light therapy, you're getting more blood moving through an area, and that's of course going to help with wound healing, wound repair, those sorts of things. In terms of inflammation, low-level laser can break certain chemical bonds in the cells where inflammation is causing an issue. It helps the cell to release things that may be inhibiting oxygen to pass that cellular respiratory pathway, and that's how it's improving with inflammation.
Wow, you've got like all the details of how it works. I feel like I've learned a lot about laser today. And I think like it's also important to note that like laser is pretty safe, so it's not like the laser you get for hair removal is a different type of laser.
All very, very different lasers. So we use a class 3B laser in our clinic, and what that means is they have to operate within a very specific spectrum, specific like milliwatt power and everything, which means it's going to be safe. Extensive studies done to show safety, so there's no issue with that, with us like burning off any single parts of your body, because when you use these class 3B lasers, you're basically operating with such a specific spectrum of light that it's not going to be causing any damage. It's near infrared. It's not even heating up any tissues in the body. It just doesn't work that way.
Cold.
It's not introducing cold into the body, but it doesn't heat up any of the tissues there. So yes, the best way to interpret that is it is just like we're using the red light spectrum and the beginnings of near infrared spectrum, and that's what photobiomodulation or low-level laser therapy is. It's weird to think it's just therapy. A light can do something, but yes, that biomechanism of stimulating that cellular respiration, it's known, observed, legitimate science. For sure.
And I know when I've used it for people when they've had like inflammation, like they've got something wrong with them, like sore, and you feel their muscle and it's like really tight, and then you do the laser over it and it's just soft and squishy and like feels like a normal, like it changes. So anyway, I just thought I'd mention it. You can feel the changes in that perspective, but from a fertility perspective, we're often doing it over the ovaries, and we're doing it to kind of improve the ATP and mitochondria.
So we'll tend to use a couple of areas, but wanting to obviously work locally, because we're wanting, in terms of fertility, to basically supercharge your eggs as much as we can. We'll be focusing the red light or the low-level laser therapy on your lower abdominal area. It also has systemic effect within the whole body to increase circulation, but we're wanting to focus that effect specifically onto the ovaries as well, and uterine environment.
Great. Thank you so much for joining us today on Making It on Monday. I feel like I'm just like the brain overload on all these all about laser, which is great. If anyone has any questions, you're always welcome to post in the comments below, and we'll get back to you. And I want to thank again Jaclyn from the CBD clinic, or Acupuncture Pregnancy Clinic, for joining us today and talking all about laser therapy.
Thank you.
It's been great to have you on.
Come see me at the city one time.
Fantastic.
Excellent.
Thanks.
Thank you.
See ya.
Bye.